If you have been diagnosed with psoriatic arthritis, you might be wondering, what is psoriatic arthritis? Are there different types? Who gets psoriatic arthritis? Why does psoriatic arthritis occur? We will address these important questions in this video. For questions about how to recognize psoriatic arthritis, check out our video that discusses the signs and symptoms of psoriatic arthritis. Hello, my name is Dr. April Armstrong. I'm a board-certified dermatologist who has cared for thousands of patients with psoriasis and psoriatic arthritis. Psoriatic arthritis is a chronic inflammatory joint disease that is associated with pain, stiffness, swelling, and sometimes loss of function. Psoriatic arthritis is a progressive condition, meaning that it gets worse over time and can lead to permanent joint damage to your joints if left untreated. Psoriatic arthritis presents differently among different people, and its diagnosis can be missed or delayed. There are 5 different presentations of psoriatic arthritis. Some patients may have a combination of these different subtypes. Number 1, oligoarticular. This is the most common type and affects 4 joints or fewer, typically in an asymmetric pattern, meaning one or more joints on different sides of the body are affected. 2, polyarticular. This type affects 5 or more joints, typically in a symmetric pattern, meaning the same joints on both sides of the body are affected. 3, distal interphalangeal. This type affects joints in the fingers and toes. 4, spondylitis. This type affects the spine and lower back. 5, arthritis mutilans. Arthritis mutilans is a severe form of psoriatic arthritis where patients have joint deformity in the fingers and toes and experience functional disabilities. This is an end-stage presentation. Because there is little we can do at this point to reverse these findings, it is important to diagnose and treat psoriatic arthritis early. Pencil ink cup describes what the affected bone looks like on an X-ray, as the end of the bone has eroded into a sharpened pencil shape. The cup refers to the inappropriate bone formation at the adjacent bone. An estimated 800,000 people in the US currently suffer from psoriatic arthritis. Symptoms of psoriatic arthritis typically occur in those aged between 30 to 50 and is more common in Caucasians than Asians and Blacks, but occurs in men and women equally. Patients diagnosed with psoriatic arthritis tend to have the following characteristics: stiffness, swelling, or tenderness of the joints. Number 2, personal or family history of psoriasis. Psoriatic arthritis occurs in nearly 1/3 of individuals with psoriasis. In about 85% of psoriatic arthritis cases, the skin changes of psoriasis come before or concurrently with psoriatic arthritis. In fact, it can take over a decade for psoriatic arthritis to develop after psoriasis first appears. 3, nail pitting. In some patients with psoriatic arthritis, they may also see nail changes. The most common nail change is small pinprick holes on the surface of the nail. Even though in many people the onset is 30 to 50 years, psoriatic arthritis can also begin in childhood, most commonly occurring in children with psoriasis. Approximately 1.4% of children in the world currently suffer from psoriatic arthritis. And similarly to adults, nearly 1/3 of children with psoriasis will develop psoriatic arthritis. It is also more common in children who have a first-degree relative with psoriasis or psoriatic arthritis. There are 2 types of psoriatic arthritis found in children. 1, the first type affects a few joints in very young children, and especially girls. Age of onset is 1 to 2 years old. Sometimes it is associated with inflammation of the eye. 2, the second type of pediatric psoriatic arthritis can affect any number of joints, and it tends to occur in kids 6 to 12 years old. Boys and girls are affected equally. These children experience similar symptoms as adults with psoriatic arthritis, including swollen fingers and toes, tendon swelling, back pain, and nail changes. Psoriatic arthritis is thought to occur primarily as a result of our genetics. Activation of certain genes in these patients leads to inflammation in the joints. External factors can also make psoriatic arthritis worse. 1, genes. The genes in our body impact how our immune system functions. Expression of the genes that are linked to psoriatic arthritis tend to lead to excessive activity in certain parts of the immune system, which results in inflammation. HLA-B27 is an important gene that is found more frequently in patients with psoriatic arthritis. 2. Inflammation. Normally, our immune cells fend off foreign or harmful molecules and help protect our bodies. However, in psoriatic arthritis, parts of the immune system go into overdrive and mistakenly attack healthy tissue in the joints. This chronic, overactive inflammatory state can cause long-term damage to the joints and ultimately result in joint deformities. 3. External factors. External factors such as mechanical stress to the joints from trauma or excessive weight may result in worsening psoriatic arthritis. For more information about psoriatic arthritis, check out our other videos discussing the signs and symptoms, as well as current treatments of psoriatic arthritis. Thanks for watching. Please subscribe to learn more. This has been Dr. April Armstrong wishing you a clear skin day.